Hello everybody, welcome to today's episode of our Health and Wellness Expo. Today I've got Felicity Campbell with me. Hi Felicity, how are you?
Hi, good, thank you. And
That's
you?
great. Yeah, I'm doing really well, thank you. Really well indeed. Felicity has a clinic called the Breathe Free Clinic. Sounds intriguing. I'd love you to tell us a bit more about it, Felicity, and a bit about yourself, how you came to have a Breathe Free Clinic and what it does.
Sure. Well, I'm a mother of two grown-up girls now, actually.
Yeah.
And I have a husband and a dog called Bella. We're living in Parongia, and I work from Hamilton and Parongia. And it was quite a long journey to get me to this point of teaching breathing, which began as an asthmatic from babyhood. And I had, through the years, been recommended to various things like yoga breathing and doing skin prick tests, food elimination diets, under clinical respiratory specialists and deep breathing relaxation trials in Christchurch. Many things. And I also had really tried to live a life that was holistically beneficial, I believed. And yet at the age of 40, my asthma was getting worse and I was using more and more medication, and I didn't understand why. And finally my GP just said to me, go and learn the Buteyko method. And initially I thought, too expensive, I've tried everything, it's not going to work. However, because I was starting to abuse my medication and needing more and more, I was getting really worried because I was very fit at the time. I was teaching aerobics and I was a landscape architect and a mother of two. So at the end of the day, when a couple of practitioners came back to our town in Taupo at the time, I decided, okay, let's do this, and ended up learning this method called the Buteyko method. And it got me off all my medication within 6 months.
Wow.
So
Wow. That's fascinating. Like, isn't that just amazing, you know, that you're just getting more and more laden with these medications? And then just a simple breathing technique helped you just remove all of that from something that had been your entire life, like, you know, your entire life you'd managed asthma in varying forms. Wow.
Well, I couldn't. It gave me my first full night's sleep. I didn't even realize I hadn't had a full night's sleep until then.
Wow.
And yes, and I didn't believe it was possible, so I knew it wasn't psychosomatic, as some might believe. And I thought one day I'll teach it, but it took a while before we had a practitioner in New Zealand that was training practitioners. And before I was at a stage where I had the time also to learn.
So tell me, how is, you know, and you know, obviously we don't have time for you to teach us and train us to be, is it Buteyko? Is that how we say it?
It's named after a Russian doctor called Dr. Konstantin Buteyko, so spelled B-U-T-Y-K-O.
Okay, Buteyko. So in simple forms, how is that different from us just breathing in and out through our nose and mouth on the daily? Like, you know, obviously we all do that. We breathe in and breathe out all the time. How is it so different that it could alleviate all of your asthmatic symptoms?
Well, you know, most people don't realize what Dr. Buteyko realized in working with heart patients was that a lot of people chronically hidden hyperventilate. And so he was teaching deep breathing methods and had a patient faint on him. So he decided to look at another way of dealing with it, which worked. And then he went looking for what the science was behind that. And so what's different is that a lot of the time we're told to big breathe as well as diaphragmatic breathe. Which is the complete opposite of what we teach. So and there's a lot of science behind it. So when I teach, I give an assessment first of breathing, and then we'll take someone on a breathing retraining program, because it's about changing habits that we develop over time. So we have a respiratory center in the brain which dictates how we breathe and the rate we breathe and the volume we breathe, and that then affects a lot of systems in the body, whether in sympathetic mode or sympathetic, so fight or flight or rest and digest, or whether our mast cells, our immune response to allergens, whether they break down more readily or not. And our pH in the body is determined by our breathing as well as the kidneys working.
Wow.
So it's interesting. And
yeah, that's fascinating. That's really fascinating. So it must help in all sorts of different situations, you know, like I remember even when I was first as a practicing planner, learning the ropes and those sorts of things, you know, I would remember these times where I now imagine people would say, oh, you were having an anxiety attack or something like that, but it wasn't labeled then, and I never labeled it anything beyond, oh my God, I feel like I'm breathing through a straw, and I couldn't, you know, like I couldn't breathe properly and everything was really tight. I imagine even in those situations, having techniques like this method would be able to help calm my system down and enable me to breathe and relax and move through all of that.
Yes, absolutely.
Wow.
Well, one of the old methods that was used was the brown paper bag for someone having a panic attack.
Yeah.
Whilst we were often told that calms, I had never thought to ask why.
Yeah.
You know, I thought maybe it was to do with slowing the breathing down, but actually what it does is it increases the carbon dioxide levels, which most of us would talk was a bad thing.
Yeah.
But the crux of some of this, of the method, or what's behind it, is something called the Bohr effect, which tells us that when carbon dioxide is not high enough, our hemoglobin, or our red blood cells, hang on to oxygen, and it won't release it to the brain, the heart, the muscles of the body. And so then you get that dizziness or feeling faint. You know, it's why people, when they're hyperventilating or panicky, feel like they can't breathe enough, and sometimes they do. So although the brown paper bag isn't safe because it's a closed system, if you had it there for a long time, you would die. But initially, that's why it was used, because it did calm. It gave the body more oxygen, and generally people would breathe slower as well. So.
Oh wow, that's really fascinating. You know, like I haven't, you know, I've looked into lots of different modalities, and my own journey's taken me on lots of different adventures and interests into different modalities and therapies and all of those sorts of things. But breathing has not been one of those things that I've really had to explore. I'm graced with kids that don't have respiratory issues largely. I have one child that gets a little bit of croup in the winter, but never anything more than the barky cough that gives them a bit of panic at night. But, you know, we can alleviate that quite simply. So I've never really had to explore it, and my own tightness in my chest and breathing through straw thing doesn't really happen now that I have built confidences and you know, like my own skill set in other ways. You know, you know, I reflect on that and see that it was me, my not necessarily my immaturity, but my lack of knowledge and lack of confidence in what I knew and what I could do in you know, situations that I was out of my comfort zone, I guess. So I haven't really explored it. So this is fascinating for me. I'm just like, oh wow, tell me more.
Well, that's how I felt when I learned it too, and I think that's the great thing. Once you start getting into integrative health, there's so much to learn, and so much overlap with different integrative health practices as well.
Absolutely.
Yeah. And you know, one of the things I hadn't realized either was that if we're not breathing well during the day, that habit continues at night. And so Buteyko really quickly realized that snoring and sleep apnea were symptoms of disordered breathing as much as anything else, and maybe not disease.
Wow.
So by, you know, it also has the ability to help people with snoring to stop snoring and to potentially come off their CPAP machines, which are recommended for people who have sleep apnea.
Wow. Yeah, no, I know a few people that actually use those or have partners that use them. And yeah, it makes perfect sense when you say it, that if we have bad breathing patterns during the day, that we're then doing it at night too, because everything is learned. So, you know, if we create those patterns during the daytime, then our bodies are going to subconsciously do it while we're sleeping. So that makes...
Yes, well, usually worse too, because the worst position for us health-wise is lying on our backs, and it's partly why hospital beds are elevated slightly, because if people have to be on their backs, then they need to be slightly elevated. I thought of something else then, can't remember what it was, but it doesn't matter. Oh, I know what it was. It's a little bit like training someone to go from California to Nepal. So, that's why we have a program, because a habit can be broken just like that. Usually it's, it takes some steps. And if you go from California to Nepal, as we know, people feel like they're running out of oxygen, or they have problems. They do it suddenly. And so they have to acclimatize, or sometimes they're giving oxygen. And so it's the same with the program. We have a respiratory center in the brain, and it's about retraining that. So that's what the program's about.
Yeah. So how long does the program run for that you generally run with your clients, Felicity?
Well, after the assessment. So an assessment will tell me whether I can help people. And I learn, they fill in a health questionnaire. And then it's a 6-session course, and of those, over 6 weeks. But the first 4 are in the first week or 2, depending on whether it's in a group or one-to-one sessions. And then the 5th one 1 week later, and the 6th one's a follow-up using capnometry, which is a biofeedback machine that I use to assess, which is a fantastic tool because it reads carbon dioxide levels and patterning and breathing rate.
Oh, fantastic.
So people can see the shift from start to finish.
So do you use that machine at the beginning to read, as part of their assessment, to read how they're breathing and those sorts of things, so you can then compare it at the end?
Yes, I can show you a trace if you're happy if I just
show. Of course you
can. I obviously can't run it, but I don't know whether you can see that screen.
I can see the screen. The content's not particularly clear. It's a bit far away, so it's maybe a bit bright on that screen, but that's okay. So
it gives a trace anyway of which shows pattern and reads what we call end tidal carbon dioxide. So anyway, I'm getting
the technical side of things. But great to know that that you have a method of reading how somebody is breathing to begin with, and then you can work through everything with them and then read it again so that they can see that real improvement. Because as a person, everyone knows it, losing weight, for an example, you never see, you're doing all this hard work and you don't see any difference, but it's not till somebody hasn't seen you for 3 or 4 weeks while you've been consciously, being diligent about your exercise and your eating and nutrition, that then you'll bump into somebody and they'll be like, oh my gosh, you're looking amazing. And you're like, oh, am I? And you can't see in that day to day, you don't see the same as what other people see. So, so it's always great to be able to have that measure to be able to notice the difference. So that's really cool. Yes. So sorry, carry on.
I can show you, actually, I just suddenly thought I can show you a screenshot of, if that's appropriate.
Yeah, of course you can. You can.
Look
how clever you are. You can do it. You can share your screen and everything with us. That would be fantastic.
Let's see. So I don't know whether you can see that.
Yeah, there we go.
Okay, so this slide is of an 11-year-old girl, and it's a condensed capnote trace. So just be aware that when I'm looking at it, it's spread out a bit more.
Yeah.
You'll probably see from this that it's pretty erratic pattern.
Yeah.
And I've been wondering whether I'd be able to help her, because I was relatively new in my practice at that point. But incomplete breathing and very erratic, and we look for good patterning and a good breathing rate. And this was her 6 weeks later. So I was really thrilled with her results.
Wow, what a difference.
So and what's powerful for her is just exactly what you've just illustrated, really, that often we don't realize the changes, and even she wasn't recognizing how much she'd improved until she saw this. And even though her symptoms had improved by about 70%, she needed the data to actually go, that's what's happened. And
so many people do need the data, don't they? Wow, that's really fascinating. I'm glad you could share that with us, because that it's totally different readings. That's amazing. Yeah.
So that rings my belt when we can get that kind of result is fantastic. And it's from 5 years plus up to 80-something year olds. So you know, I will create a niche along the way, but at the moment I'm still setting, you know, growing the business really. So
yeah, no, that's really fantastic. So how do you, so you said that you work, you've got your clinic in Prongea and one in Hamilton, so you deal with everybody one-on-one in a clinic space, or do you do online? Would you do sessions with people on a Zoom call like this?
absolutely, yes. So I work part-time out of Lisa Hanson's physio clinic when someone needs me to be in Hamilton.
Yep.
And otherwise my base is in Prongea and Te Awamutu. I can work from there as well. But so far mainly one-to-ones, but I'd like to move into the group side. That's how I trained, and what I was trained to do was in small groups, so 6 to 12 people, because people support one another. And you know, would be children's courses because we teach something slightly different to children as compared to adults, being from about 14 up. And online I've taught some people overseas and in New Zealand. So the only thing of course I can't do is the capnometry, because that is one-to-one and in person. But I can still give an assessment. Capnometry wasn't part of Buteco's training. It was developed by a behavioural physiologist in the States to help us, but it's not key to the training or, you know, understanding how this works.
Oh, that's fantastic. That's really neat. I could well imagine that as you grow your business and people become more aware of what you offer, group sessions for children would be amazing. You know, like I just, you know, you think about the number of children that are asthmatic, that do have respiratory issues, that, you know, that if there was you could do a term session, you know, like and run them through schools, even after school for children. You know, the teachers could assist in supporting those children that could benefit from it being identified, that then could do the course if the parents wanted the children to do it. You know, like there's so many different ways. And just for me, coming into and now living a very much a conscious life on terms of what toxins are in our environment and what we're putting on our bodies and what we're putting in our bodies, I would far rather try some of these natural methods of supporting my child's health, rather than just using an inhaler, for example. Like, absolutely, in some situations inhalers are absolutely necessary, not questioning that, but having these other ways, like maybe it means that they need less medication, maybe they still will always need a medication, but maybe just less of it. So, you know, like I think these sorts of modalities are just absolutely wonderful, that there's people like yourself out there that are creating a business around these things to help other people. Lots of situations.
There is a gap with the breathing, because if the respiratory clinic at the hospital is really overloaded, and yet they don't know this, and the sleep clinics are overloaded. And, you know, we think of the pillars of health being our lifestyle holistically, and nutrition and exercise, but we very rarely think of as of breathing as being able to be changed, or that it's the cause of some of the problems. And, you know, and it's that kind of chicken and egg, which came first, don't know. You know, was the breathing out and it created these problems, or did problems create the breathing disorders?
Yeah.
But, you know, illness, infection, medications can all alter our breathing, quite apart from stress. And so, you know, we don't all recognize what's going on.
Yeah, absolutely. So how are you managing with your business through this time? Obviously everybody is at home. So clinic practices and people coming to see you will have ceased, no doubt. Do you have clients that you've now transitioned into a virtual space to continue working with them? How's it working for you?
Yeah, well, fortunately, I had a number that I was still working with, so we've continued online. Sadly, all those who were booked to come and see me have postponed or cancelled. I mean, one of them was from Australia and was coming out to Cambridge and was going to bring her son over, so clearly she couldn't come, and
Yeah.
it seemed we were going to do half online and half in person. And so because I'm still in that phase of kind of growing the business, it has been a bit tough, but I'm also liking that it's given me the opportunity to do something like this, and an opportunity to consolidate what I'm doing and think about where I want the business to go. So I've got a lot of learning to do with respect to online marketing and learning more in that arena. So I'm seeing it as an opportunity now. But clearly, business-wise, financially, it's tougher, in terms of what we're doing.
Yeah, no, that's good use of your time. It's recognizing the positive of the situation, that you're just growing your business. It's like, okay, well, you don't have clients right now, so work on presentations to be able to do to other different people when you can get back out there, like you say, understand how to market yourself, use the socials, all of those sorts of things, and just get to grips with all those sorts of admin side of running a business. And that's a great way to use this time wisely, I guess. Yeah. So is there something that you can offer us just at the moment, just about our breathing, something that we can think about when we are breathing, if we're taking a moment or resting? I'm obviously not suggesting you take just the entire, that your whole method, but people say, restful breathing. It's like, will diaphragmatically breathe and fill your tummy, and big breathing and all of those sorts of things. But is that what we should be doing, or should we be doing something else? Or what thoughts have you got around that maybe you could share with us?
Yeah, well, I knew you were going to ask that. The challenge for me is that it would be irresponsible of me to anyway try and teach you the method, because actually we can get people into trouble.
Yeah.
And so I will always get someone to fill in a health questionnaire before they come to me, so I know what I can even do on the capnometer with them.
Yeah.
So there's a little bit of, I just say this with a rider, but I can give some Band-Aid ideas, and also some tips to start thinking about or to do, because even if you're not someone with any of the disorders that we've talked about, then you might be someone who could benefit from more nose breathing, and you might find you have less congestion. So even chronic cough can be partly a result or all a result of poor breathing. So and postnasal drip, and the more we do it, the less we're able to nose breathe. So if you nose breathe all the time, not just when breathing in and out through the mouth, but breathing in and out through the nose, that's a good start. Slowing your breathing down, and learning where your diaphragm sits, which is down at the base of your ribs. So when you breathe in, your muscles pull the diaphragm down and draw in air, and when you breathe out, actually there's nothing doing work, it just relaxes out. You've only got muscles that draw the diaphragm in. So learning what that is a really good start, because actually it's surprising how many people actually can't access the diaphragm. And that helps in many ways. So, but you don't want to make it big breathing. So don't breathe big breaths. Make your breathing gentle. And the other a tip, so those are some of the things that we would bring into retraining. Band-aids would be things like, instead of, if you're panicky or have any anxiety, just cup your hands over your nose and your mouth. And breathe into that through your nose for a good few minutes. And just be surprised and slow your breathing down. And you'll be surprised at how calming that is. And so it's the equivalent of the brown paper bag, but it's got holes. So you're going to have a closed system. And then one last tip I can give you, which is an old fave, but don't do this if you are someone who, if you start to feel dizzy with this, stop immediately. So if you're someone who gets a lot of panic attacks or has any heart issues, don't try this as yet.
Do not try this at home.
But otherwise, you're welcome to do this. It's a natural decongestant. So So it's called what we call the nose unblocking exercise, and it looks a bit silly. So when you see me doing this, you can laugh. You can laugh. I don't mind you laughing, but as long as you laugh at yourself too when you do it.
I will. So I will. I promise.
So you have to do it with me, Hazel.
Okay, I have no idea what I'm buying into right now, people.
Not a biggie, but anyway, what we're gonna do is we're gonna breathe in and out through our nose, and then hold our nose with our hands, our fingers. So you can either plug the nostrils if you have a sore nose, or you can just pinch the nose.
Yeah.
And we're going to hold it for as long as possible, but we're going to nod at the same time. And I'll explain at the end. Okay. So first of all, just do a check of your nostrils. So check one side, breathe in and out. And then the other. And just notice if one side's more blocked than the other and how blocked they are.
Slightly more blocked than this side. Yep.
Okay, and that's natural. We actually are on a cycle from one to the other.
Okay.
So then we're going to breathe in and out and peg. Just keep holding your breath for as long as you possibly can. And only when you can't hold it anymore, then unpeg, but breathe through the nose, not the mouth when you have to breathe in. She's trying not to laugh. And then calm the breathing as fast as you can. So try and get it into the diaphragm. And then check your nostrils. Any clearer?
Totally clearer. Okay. I was definitely trying not to laugh as I was nodding my head back and forth. So honestly, a whole lot clearer. Like this side, like I wasn't blocked, but you know, like breathing through prior to doing that, you could hear that there was a little bit of congestion of some description. But now,
so it's if we want to be able to breathe through the nose, but if they're blocked, it makes it harder. So we tend to end up mouth open. So that's and you can do that 3 or 4 times. If it doesn't unblock the first time, do it 3 or 4 times. And what you're doing is you're lifting your carbon dioxide. Your nitrous oxide also lifts, and so you get a natural germicide in there. And you're also helping circulation in the sinuses by the nodding. So it's not just so that we look silly. And it just, it helps you to be able to then nose breathe some more.
Well, that's fantastic. What a great trick. It's going to be my new party trick now, Felicity. Whenever I hear someone with a blocked nose, I'm going, oh, you got to try this.
But just with that rider, please.
With that rider, yeah. Heart conditions.
Yes, if you're someone who is prone to anxiety or panic attacks or feel slightly dizzy, when you start doing that, just stop.
Okay, with that rider. Panic attacks, anxiety, heart conditions, don't do this at home. Okay.
And there's, if you'd like to, during this COVID period, I'm offering to just talk to people for 15 minutes for free. They would like help if they are just, feeling a little bit uncertain, because as we know right now, we've got a respiratory or disease that's causing respiratory trouble as well. And so I think the healthier we are with our lungs, the better. I don't know, most of us don't know, but what I do know is that this is a really good method to help the body as a pillar of health, really. So
absolutely, and clearing to be able to breathe through our noses is a much nicer way to breathe. Way better for even gut health. So it's really fantastic. That's a great tip, and so generous of you as well. So if people would like to get hold of Felicity to have a wee chat for 15 minutes, all her details will be in the comments below. So you'll be able to access directly to Felicity's website, contact details, all her information, and learn some more about what Felicity does, which is absolutely fantastic. I've really appreciated you coming along, Felicity. It's just, I've learned so much this afternoon, having, we talked briefly before doing the interview for this, but I really didn't grasp at all what kind of technique it was and what capabilities that your Breathe Free clinic has. So that's really fantastic. I've come away with a lot more knowledge. So thank you for that. And I'm sure lots of people watching this will be fascinated as well, and likely know somebody that is dealing with some respiratory issues. So if you're one of those people, I highly recommend getting in touch with Felicity, because yeah, that's fantastic. Thank you so much for your time. It's been really lovely having you here with us.
Really appreciate it too, Hazel. I think it's fantastic what you're doing, and it's a really good way for us to learn about other practitioners as well, so we can refer to.
Yeah, absolutely.
Does it, but it might be.
Yeah, and I think there's some collaboration there too, you know. Other wellness warriors, as I'm now calling all these wonderful women that I've been interviewing, you know, they may come across somebody and, you know, they might be giving them nutrition advice, but then realize through that course that they actually have some really restrictive respiratory issues, and they may then go, oh, well, actually, have you even thought about Felicity? And, you know, there can be referrals, and you guys, there's lots of options for collaboration across the health and wellness network, because I do think when you're in that natural wellness space, that there's a very holistic way that you look at things. And I don't think there's a one-stop shop, one answer outcome for anybody, and everybody's different, and their path will be different subject to what their needs are. So having these people all brought together, hopefully people will find a connection that, you know, it might not be something that I need, but it's something that somebody else might need. So yeah, so thank you. It goes both ways. It's been an absolute honor for me to interview all these wonderful women through this expo, and I look forward to loads more contact with all of you after this expo is done. So yeah, so thanks very much. I will let you get back on with your afternoon, and thanks for joining us, everybody, and we'll look forward to seeing you with our next episode. Thanks very much, Felicity.
Thank you. Okay.